Assalamualaikum and a pleasant day everyone. My name is Husni Umangorangka and I'll be discussing about what is autism spectrum disorder or also known as ASD and how this disorder affect the students' education. Autism spectrum disorder, or also known as ASD, is a neurodevelopment condition that affects how a person communicates, interacts socially, and behaves. The term spectrum reflects the wide range of challenges and strengths individuals with autism may experience. So the core characteristic of ASD is firstly social communication and interaction difficulties. They are struggling with back and forth conversation. And second, repetitive behaviors and restricted interest. So when this disorder usually starting to appear to the child. So the autism spectrum disorder is typically diagnosed in early childhood, though it can be identified at any age. Diagnosis is based on behavioral observation and developmental history, not a single medical test. The tools used on identifying this disorder may include developmental screenings, comprehensive diagnostic evaluation, and multidisciplinary assessments. So how can the ASD affect the student's education? ASD can significantly affect a student's educational experience in various ways, depending on the individual's strengths, challenges, and support needs. Here's how ASD commonly impacts education. First, in communication challenges. The students may struggle with understanding or using verbal and nonverbal languages, which may affect their classroom participation. For example, they are difficulty initiating conversation. Second, social interaction difficulties. The students with ASD may find it hard to make friends, interpret social cues, or work in groups. For example, misinterpreting peers' intention, such can lead to isolation. And lastly, behavioral and emotional regulation. Some students may exhibit repetitive behaviors, experience meltdowns, or have difficulty managing emotions in overstimulating environments. For example, sensory overload in a noisy classroom can cause distress. So now, let us discuss what is the main cause of the ASD. So the exact cause of autism spectrum disorder or ASD is not fully understood, but research indicates that it is likely the result of a complex interaction between genetic and environmental factors. So in genetic factors, changes or mutations in multiple genes related to brain development and function increase the risk of ASD. It often runs in families. In environmental factors naman, certain influences during pregnancy, example, advanced parental age, prenatal infection, or exposure to toxins may increase risk, especially in genetically vulnerable individuals. So because of the complex interaction between these two factors can significantly cause the ASD to the person. So I hope you understand more about the autism spectrum disorder. So let us proceed naman on what are the possible treatment on the ASD. We all know that there are no specific cure for autism spectrum disorder, but there are effective treatments and intervention that can help individuals develop skills, reduce challenges, and improve quality of life. So these following are the possible treatment for ASD. First possible treatment is the behavioral and developmental therapies. Applied behavior analysis is a widely used evidence-based therapy that teaches skills and reduces problematic behaviors through positive reinforcements. And Early Intensive Behavioral Intervention or EIBI, a form of ABA for young children that focuses on communication, learning, and social skills. Second possible treatment is the speech and language therapy. It helps the ASD victims improve communication skills, both verbal and nonverbal. The third treatment for ASD is the social skills training. This teaches children and adolescents how to interact appropriately in social situations, understand cues, and build relationships. Lastly is the educational support. Individualized educational plans or IEPs in school setting tailor learning strategies and accommodations to students' needs.